We're here at the on place here at the AGA conference, together with Jakob Schanda.
Yes.
Hello. Tell us a little bit about the study that you won an award with.
Thank you very much. My name is Jakob Schanda. I work as a consultant at the AOFA Trauma Center Vienna Meidling, the largest trauma center in Austria. And I was lucky enough to perform my PhD there, and we were doing some research on chronic rotator cuff tears. So patients with chronic rotator cuff lesions also have, besides of the defect of the tendon, also a bad bone stock and the humeral head. And the idea was to regenerate the bone, to augment the bone with medication that already exists. So in this case, we tried it with zoledronic acid, bisphosphonate, the most potent of all bisphosphonates. And we performed a preclinical study in a rat model where we performed rotator cuff repair, transosseous, as previously described, in rats. Okay. And we randomized into two groups. One group was treated with the bisphosphonate, the other one got the saline solution. Yep. And we performed micro-CT analysis, and we showed that we could augment the bone mineral density and bone microarchitecture in the whole bone in the humeral head. Furthermore, we were able to show that we could also augment the enthesis, so we had larger maximum load to failure rates. And we also performed microRNA analysis, and this is the complete new topic, because we were able to show that we did not only have positive effects on bone and tendon, but also on muscle mass. And this was not known previously, that we could also perform regeneration of the muscle. And it was the case in the rat model. So this is the prize I won for, and I'm very, very humbled and thankful for that. And I'm very happy to announce that we just started in this setting a clinical study to investigate the effects of zoledronic acid in a clinical model.
All right.
Yeah.
That's very cool. Very interesting. So how will your results be relevant, clinically relevant for your current practice?
There are many different indications for zoledronic acid or bisphosphonates, or actually for anti-osteoporotic medication in general in orthopedics and trauma surgery. There are studies showing that in case of aseptic loosening of the femoral shaft, in case of prosthesis, you could reinforce the shaft again with a single dose of zoledronic acid. We were able to show also that in case of Pertus disease in children, the humeral head, which completely deforms, can be stopped actually. And the same counts for also integration of screws and of plates, which can be augmented and performed, even better performed, using some drugs on skeletal muscle mass. So when we could show that we also have an effect on the tendon, or the healing tendon, this can really be a revolution to the clinical practice, as we could augment our patients with these drugs that are clinically available all over the world.
Okay, very cool. Last question, what do you think you will find in your currently performed RCT?
I can't tell. Of course, I'm hoping that we have nice results. We have 80 patients to include. All patients will be randomized into two groups. One is the control group, one is the intervention group, with a single dose of zoledronic acid. The study is randomized, placebo-controlled, double-blinded, and we have to see. Our results will focus on MRI after 6 and 12 months, where we could maybe see a difference in the tendon healing, classified as SUGAIA. I did already in 2005. Furthermore, we want to focus on the muscle belly of the rotator cuff, if we could have an improved muscle regeneration. And as we did already in our preclinical study, we will perform microRNA analysis in all patients to see if we have also a cellular impact of the drugs that we give.
Okay, very cool. Well, congratulations again with your awards, and good luck with the study. We're looking forward to the results.
Thank you very much.